The incision is made just behind the umbilicus, as this is an older dog. Rather than blunt dissection, the fat is nibbled away, so that we can clearly see and grasp the linear alba. It clearly separates muscle and fat on closure. It also prevents subcutaneous fat being caught in the ovarian clamp. Lift the muscle as much as you possibly can. Make your reverse blade stab incision and extend with scissors, with or without submuscular forceps, but these shorten the muscle extension. Only once experienced, consider raised submuscular forceps and inverted blade. Use your right index finger to slide down the muscle wall. Keep all abdominal contents behind it. Touch the vertebrae and slide back up, hooking your finger. The uterus is usually smaller and more tubular, but can vary greatly in size. With your left hand push down on the body wall, then grasp the uterus with your left hand. Then transfer it to your right. You can pull on the ovary as the suspensory, and renal ligament take the strain, not the uterus or ovarian vessels. Breaking of the suspensory is a vital skill. There are two ligaments. The renal runs straight to the kidney. Leave this well alone, as later protects the ovarian vessels. The suspensory runs round the back of the kidney and inserts to the last rib. This one we break. The further down you are, the safer you are. The right suspensory will break in seconds once you have the knack. Press down at the insertion to the rib, or as close to it as you can get. The next step is to make the window in the broad ligament. So, we can place the ovarian clamp across the pedicle. The window has to be away from the vessels, in a translucent area, and quite low down as we want to place the Miller knots low. Ideally, use a car-malt clamp as these are less aggressive. Don't force the clamp down, walk it down, while holding the ovary. Remove any fat or skin that gets caught in the clamp. Once happy with the position, apply a couple of clicks of the clamp. Clamping and separating the uterus may seem very strange at first. It is perfectly safe and you will see the benefits. Regards the amount of exposure you gain. Form your millers and leave it loose. Now nudge it down so the miller knot bites lower. Then tighten. These must be tight. If you cutting through the fat, great, keep going. They have to be tight every time, otherwise you will have bleeders for sure. Cut the tails short, otherwise they get caught in the next millers. Raise your clamp and apply second millers. It doesn't matter if it goes in the same crush bed or not.
Remember, tighten, tighten, tighten.
I cannot stress the importance of this enough. Everyone checks for a bleeder by hanging onto the thread of broad ligament after cutting off the ovary. If there is bleeding, trying to re-expose the broad ligament is very difficult. With this technique, we just remove the clamps and check, and to reapply a clamp and add another ligation is so much more simpler. If use this technique, you should never have the surprise of a bleeder. Once happy no bleeding, replace clamp. Ensure you are clearing the ovary, so no chance of ovarian remnant syndrome. Cut off the ovary, flush with the blade. Some vets just tear the broad ligament, but this can sometimes lead to significant bleeding. Keep the stress low and ligate. The uterine vessel stays with the uterus and a window is made in a translucent area. Ligating the broad helps expose the other side and removes away the fat for uterine ligation. If small, place a surgeon's. If large, place a miller's. Put some tension on the uterus and follow it down, feeling for the bifurcation. Note occasionally the uterus twists, so surprisingly, the bifurcation can be on the other side. Once you have the bifurcation, feed along it to midway and then exteriorize. If you try to do this at the bifurcation, the uterine horn is held down. Push down with the left hand to grasp ovary. Then pull with tension to exteriorize and then swap to right hand. It is important you have just the ovary and pull just on the ovary, otherwise the uterus may snap. Breakage of this suspensory on this side is harder. It is generally 2 to 3 times thicker. Try the technique of sliding down the suspensory, feeling it go around the kidney and push down at rib insertion. If this doesn't work, try pushing laterally and break the suspensory in 2 places. If this doesn't work, on the lateral side of the suspensory, hook your finger under and push upwards. Stay as cranial as possible as this keeps you safe. Place and walk the clamp down, 1 to 2 clicks once in position. Now separate your uterus to improve ovarian exposure. When you remove the top clamp to raise the ovarian clamp, reapply. Otherwise, sometimes new grads have got this tissue caught in their ovarian ligations. This is a super safe way of checking for bleeding. If you have any concerns, reapply clamp and add another ligation. It all looks good, so clamp reapplied, checking the ovary is cleared, and remove with a blade so it's flush to the clamp. The broad ligament is tied off. With the uterus, we cannot get to the body, so rather than extending to a very large incision, we take what we can. Remember that nearly all the vets in Europe leave the whole uterus behind. When it comes to the uterus, we can only ligate the horns. With the uterus, I never use crush beds, as I have uteruses fall to pieces. My first ligation is a surgeon's knot, as this is less likely to cut through when compared to a miller's. If I am worried the uterus is fragile, I will place to millers, the first one semi-tight, the second one fully tight. Some unis refer to the golden centimeter, which is the distance from ligature to cut. We now close the muscle with a simple continuous pattern. About halfway along, we place an Aberdeen for extra security, and then finish with the continuous pattern with a surgeons. At the end of an Aberdeen, pass the needle through twice. Not so important with an Aberdeen mid-muscle closure, but get in the habit of doing it, as it gives a much more stable Aberdeen. Finish the muscle layer with a surgeons. These provide a safer anchor. Close the fat layer with a simple continuous. It is important to bury the knot. Start one side deep superficial and the other side superficial deep and tie the knot. First pass has to be deep superficial to keep the knot hidden. Once the suture pattern is finished, I closed with the surgeons. This knot is the anchor for the continuous intradermal pattern. It is important that the knot is hidden and not sticking upwards. I first try to hide it in the fat and take a subdermal bite, going cranially. This fails as it causes a bulge in the skin. So I remove the pass and go more cranial to the knot, passing deep into the fat and under the knot, coming out in the intradermal position. For bearing this knot, there is never a set rule, it is whatever works. I probably should have gone again, even more cranially, to lie the knot flat, but decided it should be okay, once the skin is closed. I prefer to finish with a surgeon's. It is a stronger knot, but wanted to show you the Aberdeen knot. You form a loop on one side and then you have the suture on the other side. Go through the loop and grab the single piece, this single piece, then become a new loop. And then again go through the loop to grab the suture, with this forming a loop. Tighten the knot by spreading your fingers in the loop. Most people do about 4, but I prefer a longer knot and can do 9. At the end pass the needle through the loop, around and then through the loop again. So, it's the double pass, which prevents the likelihood of the knot falling to pieces. It is essential this knot is buried. If it sits between the skin cannot heal and you will get a wound breakdown. Pass the needle very close to the knot, ideally through a small hole you left, by finishing the intradermals a little earlier. Pass the needle into the wound and then lift the skin over the needle, so it comes out quite some distance away. This is important with an Aberdeen knot. Generally, if the needle passes through easy, the knot should bury. At the end, don't just pull hard on the suture for burial. Instead, pull some force, but mainly lift the skin over the knot with rat tooth adsense. Once buried, trim the tail sticking out of the skin.